Temporal bone is a paired cranial bone. It has five parts: squamous part, mastoid part, styloid process, and tympanic part, and another near the base of the skull, the petrous part. Determination of site can be done by 3 points. The zygomatic process present in the external surface is directed anteriorly. The squamous part, which is like a thin plate, is directed superiorly. The petrous part of the temporal bone is directed forwards and medially. Therefore, this bone belongs to left side. Squamous part has two surfaces, a external surface also called as temporal surface and internal surface are also called as cerebral surface. It has two borders, one superior border and another is the anterior-inferior border. Superior border articulates with the inferior border of the parietal bone, and the anterior-inferior border articulates with the greater wing of the sphenoid bone. The squamous part has a process called as zygomatic process directed anteriorly. It has a fossa on the inferior aspect called as mandibular fossa. Features of the external surface are it has a crust called as supramastoid crust which will be indicating the posterior border of the temporal fossa. The external surface forms the temporal fossa. Below the crust and above the posterior superior part of the external auditory meatus, there is a triangle called as suprameatal triangle, and that will be indicating the mastoid antrum, which will be located 1.25 cm deep to the surface. Temporal fossa gives origin to temporalis muscle. Internal surface is related with the temporal lobe of cerebrum. It has a groove for the middle meningeal artery. Anterior part of the zygomatic process gives origin to masseter muscle. Posterior part of the zygomatic process has two surfaces, a inferior surface and a superior surface. The inferior surface presents two roots, a anterior root and a posterior root. Anterior root forms a tubercle called as articular tubercle, and the posterior root, both the two roots converge towards a tubercle called as the tubercle of the root of the zygoma. Mandibular fossa has two parts, a articular part and a non-articular part. The articular part is formed by the squamous part of the temporal bone and the non-articular part is formed by the tympanic part of the temporal bone. In between these two, there is a fissure called a squamotympanic fissure. Mandibular fossa articulates with the head of the mandible, forming the temporomandibular joint. The articular tubercle and the mandibular fossa give attachment to the articular disc of temporomandibular joint. Tubercle of the root of the zygoma gives attachment to the lateral ligament of temporomandibular joint. The squamotympanic fissure is divided into two parts by a thin plate of bone called as tegmen tympani into petrotympanic fissure and the petrosquamosal fissure. Petrotympanic fissure transmits the cauda tympanic branch of facial nerve. The mastoid part has an external or lateral surface and an internal or cerebral surface, and it has two borders, one the superior border and another one is the posterior border. Superior border articulates with the inferior border of the parietal bone. The posterior border articulates with the squamous part of the occipital bone. The meeting place in between the occipital bone, parietal bone, and the mastoid part of the temporal bone is called as asterion. External surface gives insertion to splenius capitis. External surface gives insertion to sternocleidomastoid muscle. External surface gives origin to occipital belly of occipitofrontalis. Internal surface presents a sulcus called as sigmoid sulcus which lodges the sigmoid sinus. Mastered part has a process called as mastered process. The mastered process internally has mastered air cells. On the medial aspect of the mastered process, there is a notch called as mastered notch. Mastered notch gives origin to the posterior belly of digastric muscle. Petrous part is a hard part. It has three surfaces: anterior surface, posterior surface, and inferior surface. Petrous part has three borders: superior border separating the anterior surface and posterior surface, anterior border separating the anterior surface and inferior surface, and a posterior border separating the posterior surface and inferior surface. It has an apex pierced by carotid canal and a base which is fused with the squamous part of the temporal bone. Anterior surface near the apex presents a depression called as trigeminal impression for the trigeminal ganglion. It presents an eminence called as arcuate eminence, which is formed by the superior semicircular canal of the internal ear, and a thin plate of bone called as tegmen tympani, which forms the roof of the tympanic cavity as well as the roof of the canal for tensor tympani, and it forms the lateral wall of the auditory tube. The red color stick represents the canal for tensor tympani, and the white color stick represents the canal for auditory tube. Trigeminal impression lodges the trigeminal ganglion. Superior surface of tegmen tympani presents two grooves, groove for the greater petrosal nerve and groove for the lesser petrosal nerve. Greater petrosal nerve carries the secretomotor parasympathetic fibers of facial nerve to the lacrimal gland. Lesser petrosal nerve carries secretomotor parasympathetic fibers of glossopharyngeal nerve to the parotid gland. Posterior surface has an opening called as internal auditory meatus through which the facial nerve enters in and the vestibulocochlear nerve emerges out. Behind this, there is another slit-like opening called as the aqueduct of the vestibule for the ductus endolimphaticus and the saccus of the internal ear. Inferior surface has the opening of the carotid canal through which the internal carotid artery enters in. Inferior surface has three canaliculi. Cochlear canaliculus transmits the aqueduct of cochlea. Tympanic canaliculus transmits the tympanic branch of the glossopharyngeal nerve. And the mastoid canaliculus transmits the auricular branch of the vagus nerve. Inferior surface near the greater wing of the sphenoid bone presents a sulcus called sulcus tubae, which lodges the cartilaginous part of auditory tube. Inferior surface gives origin to levator veli palatini muscle. Superior border has a groove which lodges the superior petrosal sinus. Superior border gives attachment to tentorium cerebelli. The posterior border has a groove which lodges the inferior petrosal sinus. The posterior border, along with the jugular notch of the occipital bone, forms the jugular foramina. Jugular foramina transmits glossopharyngeal nerve, vagus nerve, and accessory nerve, and the inferior petrosal sinus, and the sigmoid sinus continues as the internal jugular vein. Anterior border, medial part, articulates with the greater wing of the sphenoid bone, and the lateral part articulates with the squamous part of the temporal bone, forming the petrosquamosal suture. Tympanic part is a thin plate of bone located in between the squamotympanic fissure and the tympanomastoid fissure. Tympanic part has two surfaces, anterior and posterior, and three borders, upper border, lower border, and lateral border. Lateral border forms the margin of external acoustic meatus. The anterior wall, the floor, and the lower part of the posterior wall of the external auditory meatus is formed by the tympanic plate of the temporal bone. The roof and the upper part of the posterior wall is formed by the squamous part of the temporal bone. Posterior surface of the tympanic part has a sulcus called as tympanic circus, which lodges the tympanic membrane. Styloid process gives attachment to stylohyoid ligament. It also gives attachment to stylomandibular ligament. Styloid process gives origin to styloglossus muscle. It also gives origin to stylopharyngeus muscle. Styloid process also gives origin to stylohyoid muscle. In between the styloid process and mastoid process, there is a phenomena called a stylomastoid phenomena. It transmits the facial nerve. Applied anatomy of temporal bone. Temporal bone fractures leads to hearing loss, tinnitus, dizziness, CSF otorrhea and rhinorrhea, and facial nerve paralysis. Petrous part of the temporal bone can get fractured longitudinally along the anterior border, or it can get fractured transversely. It will lead to damage to the internal ear.